So good morning all of you. Today we are talking about the external ear. So the ear is something which is actually not only catching up, it's a sense organ definitely, not only for hearing, it is also for balance. And the receptors, you have definitely the hearing receptors, sensory receptors, and then special ones, and then also there are mechanoreceptors. Okay. So now coming to the ear has mainly three parts. You have the external ear, middle ear, which is concerned with transference of sound, and to the internal ear, which contains the organ for equilibrium as well as the end organ for hearing. And the tympanic membrane is something which separates the external ear from the middle ear. The pharyngotympanic tube is the eustachian tube which joins the middle ear to the nasopharynx to keep the atmospheric pressure and the pressure behind the tympanic tube equal. Otherwise the vibrations of the tympanic tube won't be picked up. Okay, so now coming to the three parts of the ear in details. So you have the external ear, which mainly consists of the pinna, the external acoustic meatus, and the tympanic membrane. Okay, so the pinna is mainly for amplification and localization also of the sound waves, and it takes up the sound waves and directs it within the external acoustic meatus. And you have the pinna is actually made up of elastic cartilage, which is very important point because it can be asked. Okay, and then we are having the external acoustic meatus, which is about 2.5 centimeter. We'll come to it in detail. And it also secretes it has a cartilaginous part and it has a inner bony part, which is about 2/3 of the canal, and the outer cartilaginous part will secrete cerumen or wax. So it has ceruminous glands and also hair. And then you have the middle ear, which has the ossicles. It also has the chorda tympani nerve, and it is also having the bones also, the ear bones. Okay, now coming to the external ear, which is of the topic of concern today. So you have three main parts: the pinna, the external auditory canal, and the outer surface of the tympanic membrane or the tympanic membrane. And it is mainly involved in hearing. It does not take part in balance. Okay, now coming to the pinna. Pinna is actually a piece of yellow elastic cartilage. Now it is containing yellow elastic cartilage, and this type of cartilage has a perichondrium. Okay, and then there are some parts of the pinna. You have the helix, the antihelix, the concha. Okay, and so this is because the way the cartilage is folded up and down, you are getting that. And even you can see the tragus, which is actually the protruding part just above the external acoustic meatus, starting of the external acoustic meatus. And how this pinna is attached to the head? It is attached by ligaments and muscles. The pinna is not movable for humans, and so the muscles are not well developed. Okay, so now coming to the nerve supply and blood supply of the pinna. You have the lateral surface of the pinna, the medial surface. The lateral surface is supplied by the auriculotemporal nerve and the great auricular nerve, whereas the medial surface is supplied mainly by the great auricular and also the lesser occipital nerve. You can see a purple color rounded area, which is also continuing into the external acoustic meatus and also the eardrum or the tympanic membrane, and that portion is actually supplied by the auricular branch of vagus or the Arnold nerve. Now this is very important because if stimulation of this nerve can result in cough reflex, because you already know that vagus supplies the pharynx and the larynx by forming a plexus, that is the pharyngeal plexus. And so this part of the stimulation of this nerve, because of cleaning of the acoustic meatus, external acoustic meatus, can actually lead to cough reflex. Now coming to the blood supply, you have a posterior auricular, superficial temporal, and deep auricular are the branches of the external carotid artery, which supplies mainly the external ear. And also the lymph nodes. What are the lymphatics it drains? Drains into the p-auricular mastoid and the superficial cervical lymph nodes. Now a part of this pinna, which is also called the lobule, which does not, the lowermost part of the pinna, which is called the lobule, does not have this elastic cartilage in it, and that is the place where we pierce the ear, okay, because it does not contain the cartilage, that is the elastic cartilage is devoid in the lobule. Okay, now coming to the next slide. Okay, let's go to the next slide. Okay, now this is showing you the basically the nerve supply of the pinna. You have the outermost, that is the lateral aspect, by the great auricular nerve, and also by the lesser occipital nerve, and then you have this applied anatomy. Now coming to it, has a lot of applied anatomy. I already told about the tracheal cartilage, which is very important for reconstruction surgeries of the middle ear, especially the perichondrium of the tracheal cartilage is used for reconstruction of the tympanic membrane, perforations of the tympanic membrane. Conchal cartilage has been used in correcting the nasal bridge, so it is also used for cosmetic surgeries. Composite grafts of this cartilage has been used to repair the nasal ala. So all these things, especially for facial injuries and all, we can reconstruct those areas. Now coming to the next part of the external auditory meatus, that is the external auditory canal, which is about 2.5 centimeters. It is not a straight tube. It has an outer cartilaginous part and the inner that is bony part, we already have told. And to make this external auditory canal straight in adults, we have to pull the pinna backwards and laterally, okay, to make it straight. So it has also two constrictions. You have to remember that it is S-shaped and it has an outer 1/3 is cartilaginous, inner 2/3 is bony. So outer 1/3 cartilaginous, 8 millimeter canal, continuation of the cartilaginous part which forms the framework of the pinna also. Okay, now coming to the next thing, that I told you already that the skin covering the external part, that is the cartilaginous part, outer 1/3 is thick and contain appendages like ceruminous glands which actually secrete the wax, and also contain pilosebaceous glands and hair follicles also, and therefore furuncles and all these things can be seen only in the outer 1/3 of the canal. Now coming to the next part, that is the bony part, which is the inner 2/3 of the canal, 16 millimeter, and the skin lining the bony canal is thin and it is continuous over the tympanic membrane, that is the outer layer of the tympanic membrane it forms. It does not have any skin appendages, and it is also becomes narrowed, and this narrowing of this bony part is called the isthmus. About 6 millimeter lateral to the tympanic membrane, it gets narrowed and it is called the isthmus. And foreign body, if it is impacted in this medial to this isthmus, becomes very difficult to remove, because if it goes once, it is very narrow. Okay, now the anterior inferior part of this deep meatus is having a recess which is called the anterior recess, which acts as a cesspool for discharge and debris. Anterior inferior part of the bony canal may present sometimes in adults, permitting infection from the parotid gland, and so that is called the foramen of Huschke. Okay, coming to the nerve supply, again more or less it is auriculotemporal nerve which is supplying, and auricular branch of vagus which supplies the posterior inferior part of this canal, and also the facial nerve which comes through this auricular branch of vagus, which is actually the only component, sensory component of facial nerve which supplies the auditory canal. Okay, coming to the tympanic membrane, which is the third thing which is important in external ear. You have this tympanic membrane, which is actually a membranous structure, and it is about obliquely set at the end of this canal at an angle of 45 degrees, and the posterior superior part is more lateral than the anterior inferior part, and it is about 9 to 10 millimeter tall, 8 to 9 millimeter wide, and 0.1 millimeter in thickness. So remember that it is 1.1 millimeter in thickness, and it is actually angulated. Okay, so it is not straight. So tympanic membrane has two parts. You have a pars tensa, you have a pars flaccida, which is also called the shrapnel membrane. The upper part is the pars flaccida, and which fits into the notch, which is called the notch of Rivinus, and that bone is part of the temporal bone. The notch is formed, and the pars tensa is fitting into a fibrocartilaginous rim, which is called the annulus tympanicus. Remember that this is a fibrocartilaginous rim or a ring, which is annulus tympanicus, which fits into the tympanic sulcus. Okay, and the central part of this pars tensa is tented inwards, that is towards the middle ear. Okay, so tented inwards because the handle of the malleus is attached to the central part of the inner surface of the of this tympanic membrane, and that results in formation of something called umbo, and keeps the tympanic membrane quite tense and pulled inwards, and that tension in the tympanic membrane is necessary for its vibration. When in otoscopic examination, you can see on otoscopic examination a bright cone of light can be seen radiating from the tip of the handle of malleus to the periphery, and it is always inferiorly directed. So anterior inferiorly for left side and right side, depending upon the but it is always inferiorly directed, but depending upon the side it can be at 7 o'clock position or at 5 o'clock position, but always it is directed inferiorly. That is also called light reflex in case of tympanic membrane. Pars flaccida is situated above the lateral process of the malleus or the handle of the malleus, just above the folds also, malleolar folds also, between the notch of Rivinus and the anterior and posterior malleolar fold. It appears pinkish. Now over here you can see that the umbo is something where the handle of the malleus is attached to the inner surface of the tympanic membrane, and then that is pulling the tympanic membrane inwards, and then you have the pars flaccida which is above. You can see one nerve over here which crosses the tympanic membrane from anterior to posterior. That is the cauda tympani, which is over the pars flaccida, and the pars tensa is the lower part, and then you can see the anterior and the posterior. And remember that the tympanic membrane is made up of 3 layers also. So we will be coming to the layers of the tympanic membrane. This is just showing you the incus and the malleus, and the handle of malleus, how is it attached, and the cone of light also. Okay, now coming to the layers of the tympanic membrane, you have an outer epithelial layer or the skin which is continuous with the skin, inner mucosal layer continuous with the mucosa of the middle layer, middle fibrous layer is also there which encloses the handle of the malleus, and it has fibrous tissue which is actually arranged in a very organized way for pars tensa, but for pars flaccida it is not organized, it is disorganized fibrous layer. Remember that these 3 layers of the tympanic membrane are actually developing from the 3 derms. Okay, so the outer layer is from the ectoderm, the middle layer is from the mesoderm, and the inner layer is from the endoderm. Okay, so now coming to the nerve supply of tympanic membrane, extremely sensitive to pain. Outer surface supplied by auriculotemporal nerve, auricular branch of vagus, inner surface supplied by glossopharyngeal nerve, and so it is actually the middle ear cavity, the full cavity is supplied by glossopharyngeal nerve, the inner surface, and these are all sensory supply, and it is extremely sensitive to pain. Okay, coming to the applied aspect, otoscopic examination, we already talked about the nerve supply, the light reflex, and also you have to observe the external acoustic meatus, and also have to observe the tympanic membrane for any perforation. How do you make this external acoustic meatus straight? By pulling and grasping the pinna in adults and pulled posterior superiorly, which reduces the curvature. And you can, in case of infants and children, the meatus is short, so extra care should be seen to prevent injury to the tympanic membrane. And the tympanic membrane normally translucent, it is pearly grey, and the handle of malleus is seen. The shadow of the handle of malleus is clearly visible at the center of the membrane, and that is called the umbo. From the inferior of the handle of membrane, you can see a bright cone of light, which is actually called the light reflex. I have already told you, and it is visible always anterior inferiorly in healthy ear. Okay, so not in perforations and all. Okay, now coming to the acute otitis externa, which is an applied aspect, and this is also called the swimmer's ear. Infection of the external acoustic meatus, inflammation and infection, and it also causes pulling of the auricle or pressure over the tragus can cause pain. It needs treatment, and it also causes itching, mainly in cases where you are not making the external ear dry, those cases, and this can lead to acute otitis externa. Okay, now this is showing the otoscopic examination of the external ear and the tympanic membrane visualization. You can see the right side, we have the tympanic membrane, the handle of malleus is seen, or the manubrium of the malleus is seen very clearly. Cauda tympani nerve is approximately at that position where it is shown over the pars flaccida, the upper part, and the cone of light reflex. This is the right side, so you are seeing at the 5 o'clock position, right side ear, whereas left side ear it is at the 7 o'clock position, but always directed inferiorly. Okay, so this shows how an otoscopic examination, how the tympanic membrane will look in case of a healthy ear. Okay, so this completes. So to summarize, you have mainly 3 parts of the ear. You have an external ear, middle ear and inner ear. Today, coming to the external ear, three things we are focusing on. One is the pinna, and then next is the external acoustic meatus, its length, the curvature and the components of the external acoustic meatus. And then you have the tympanic membrane, which is very important because it can come as a short note for you, and the layers of the tympanic membrane and how is it derived embryologically. Nerve supply of the tympanic membrane is important. The parts of the tympanic membrane is important. Which nerve is related to the tympanic membrane inner surface? What ear ossicle is attached to the tympanic membrane on the inner side surface, and the light reflex, definitely the cone of light. These are all very important applied aspect. Autoscopic examination, acute otitis externa for tympanic membrane. Okay, so this completes your external ear, and thank you.